Hi, I'm Veronique. I've been wanting to start a blog for a couple years now, and I have chronic fatigue, which I've had for about 15 years. And I've just been waiting to have enough margin to be able to show up with some kind of regularity. I used to be a family doctor. I taught residents and medical students and delivered babies. And I started getting tired then. And I had no idea what it was. I thought it was stress related, but it's turned out to be a whole lot more. I ended up leaving medicine though, not because of the fatigue. I really wanted to find a different way to work with chronic illness. I wanted to understand what drives it and treat that more than treating symptoms. And I ended up taking a year off, figuring out what I wanted to do, retraining as a psychotherapist, and that opened up all sorts of doors and ideas that I've been exploring very personally with my own experience for more than 10 years now. And so that's kind of the things I want to share. I want to talk about my personal experience and what I've been learning, how I work with it on a day-to-day basis, how I work with it with my husband, how we work with this sort of third party in our relationship. I want to share the literature too, which is one of the things that I've unexpectedly just gotten really intrigued by. I have over 8,000 references that I've collected in the past 10 years, and I think it's pretty fascinating. It's led me to a whole different way of looking at chronic illness and how life events, especially traumatic life events, seem to play, I think, a pretty important, if not critical, part in putting some of us at risk. And I think it starts in our lineage with our ancestors and what their life events were like as an initiation of risk. And then I suspect it's followed by a need for a number of sequences of events, prenatal events, birth stress, and then difficult events in childhood, and they may not look really big or severe, but I think there's a sequence of events that put some of us at risk, initiates a pattern that may lead to chronic illness, and then it gets perpetuated by more events that sort of trigger the same pattern to develop more strongly, and then it's precipitated by sort of the final stressful event. So I'm going to talk about that and share some of the research, while I also talk about the day-to-day and how it works and what the challenges are like and what I'm trying. And I am still ill. I'm still really debilitated by my fatigue, which is why I'm doing this in my coat instead of and my hat and outdoors today spontaneously, rather than waiting until I can take a shower and put some makeup on and look even more presentable. So, welcome to the blog. I think it's going to be a really helpful place to put out all these ideas to, and I really look forward to meeting you guys.